Hi everybody, Chris Coleman here, certified hand therapist, and here today we are going to talk about distal radius fractures. Distal radius fracture is a fracture that occurs in the radius bone, ulnar bone, radius bone. Probably one of the most common fractures I have seen in the 20 years that I have treated. I always seem to have at least one or two to five of these in my practice at one time, and they typically result from what we call a Foosh injury. Foosh is an acronym, F-O-O-S-H, fall on outstretched hand. So when we end up falling, we end up putting our hand out to protect our face or protect our vital organs if it's a forward fall. Or if we end up falling and we end up going backwards, we put our hand back, and often the force of the fall will overcome the strength of the bone, and you will get a fracture in the distal radius. Typical ones that I've heard of reasons why are sporting events where people end up falling. They weren't planning on it and fell and put their hand out as a reflex reaction. We also see it in this type of year. I'm shooting this in January. So with snow and ice, there's a lot of falls that you see because of that, and unsteady footing. Going off of curbs, people end up falling because of that unstable surface. And also you end up seeing it in elderly people as well. As we advance in age, our balance gets challenged more, and people end up falling more. And also with osteoporosis, which is a loss of bone density, the bone ends up getting weaker. So it's actually the perfect storm for people that increase in their falls with decreased strength in their bone. They end up fracturing that distal radius. And one of the best lines I've ever heard from one of my patients was actually a 93-year-old woman who fell, suffered a distal radius fracture, and I asked how she was doing, and she told me, looked me square in the eye and said, "Sonny, getting old is not for sissies." And that's always stuck with me, and I always tell my patients that, because as we get older, the machine we call the body tends to break down a little bit more, so that always rang true to me, and I always remember it. Now, when you do fracture your wrist, sometimes it's very obvious. Sometimes the bones are not aligned, and you can see they go in a crazy zigzag formation or twisted and bent, but sometimes you can't tell. Sometimes, it hurts and you're not quite sure what happened because it's not quite as obvious. So you end up going to an emergency room or urgent care or to an orthopedic, and they obviously take an x-ray of it, and they'll pop up the x-ray, and you may have a hairline fracture. Hairline fracture is a kind of a minimal of a fracture. It means that the two bones are still in place and there's just a little crack in between there. Those typically just are immobilized in a cast for 4 to 6 weeks, and then you come out of the cast and you're going to be a little bit stiff from not having moved some things, and likely require a little bit of therapy to get things going again. If the fracture is more of a significant, if it's in a couple pieces, if the bones are no longer together, if they are displaced, as they call it, you will likely need some surgery. And the surgeon will go in there, and the surgeon will put the two pieces back together the way they're supposed to be, and then often use what they call a volar plate, which is a piece of titanium or some sort of metal. I'm not exactly sure of the technology. And then they will put screws in there to hold the two pieces together as the bone ends up healing itself. The advantage of that is that we don't have to wait 4 to 6 weeks to work on your range of motion. The fixation is often very strong, and after a couple days of being in your post-surgical dressing, that can come off. You can often go in some type of removable brace, and then we can start to work on the motion in the wrist and in the forearm, and we can get after that from a rehabilitative standpoint. So, if you do have this condition, if you know someone who has this condition, you want to check in with me at jchriscoleman.com is my email address, or you want to check out my website, helpforthehand.com. It has a blog on this and you can go ahead and you can check it out and get a little bit more information on it. But certainly please email me. I certainly have a bunch of strategies and some tips and things that I can help you if you're having trouble doing things with your hand while you are having this condition, there's some tricks, there's some exercises, there's some other things we can certainly point you in the right direction. Or if you just want to check in with me, I certainly do not want to take the place of your therapist. I highly recommend that these conditions you can seek some professional advice and go to a physical or an occupational therapist, preferably one that has a certified hand therapist credential behind them, as we are experts in upper extremity and have achieved a certain level of specialization in that and have seen these things back and forth. So I wish you all the luck in the world if you have these, and please feel free to reach out. I'm happy to help. Take care.